Welcome everyone back to the Healthy Habit Podcast. I'm your host, Dr. Dayan of Healthy Habit Medical Center, located right inside Healthy Habit Health Foods. We got a special guest here joining us. Fellow naturopathic physician is back with us, checking in from Ayurveda and Ayush Herbs, here for episode 227 of the podcast. If you're new to the program here, just YouTube or or Spotify, the Healthy Habit Podcast, and just hit follow and hit the bell icon. You'll be notified when this episode comes out here with Dr. Sodhi, who's an internationally respected Ayurvedic and naturopathic physician, credited with evolving the understanding of Ayurvedic herbal medicine in the West. Dr. Sodhi became an Ayurvedic doctor in 1980, and he worked as medical professor Ayurvedic until 1986. And then in 88, he became the first Ayurvedic and naturopathic physician in the United States. And folks, check out his latest book called Free Medicine, Your Body, a Natural Pharmacy. And Dr. Sodhi is currently practicing at Ayurvedic and Naturopathic Medical Clinic in Bellevue, Washington, with a focus on oncology. One of our last episodes was 195 with Dr. Sodhi, where we covered Ayush Herbs for heart health. We discussed heart disease as the silent killer and how Ayurveda can help address this. Arjuna Health, the Arjuna Heart Formula, importance of CoQ10. We even covered curcumin by Ayush Herbs. So check that one out, folks. Highly informative, episode 195. Dr. Sodhi, welcome back.
Thank you, Dr. Dijan. It's always a pleasure to come back and talk to you.
Well, I appreciate your time and all the information you bring and clinical experience that you educate us with. So this is going to be an important episode under the umbrella of mental well-being and conscious living. So a lot of people have mental health more on their radar now in the last 10 years especially. What does that mean to you, Dr. Sodhi, mental well-being? How do you see it connected to live consciously in today's fast-paced world? How do we combine this? Why is this so important?
So basically, Ayurvedic medicine, many centuries ago, very clearly defined that your blood chemistry can be normal, you can be physically fit, you do exercise, but when you're not mentally healthy, you're not healthy.
Yeah.
So there was actually a phrase that you can have all those faculties, everything normal, but if your mental faculty is not good, you're not any good. So they call it a blissful heart. So you should have the bliss in your heart all the time. And these situations can go south or north. We don't have a control over it. What we need to do, perform, act, and that's what, if you know about the Indian philosophy or Hindu philosophy or Vedic philosophy, it calls about the karma. Karma means action. So we need to be active and doing our karma, doing our action, and then we should not be looking forward to the results of it, because whatever comes is not my control, is not your control, is somebody else's control. But
Right.
That doesn't mean that we should not do our action. So the mind is such a powerful identity. The positiveness, balance in your mental, physical, spiritual well-being is so important that it makes your body very robust and healthy. You can be eating healthy, you can be doing exercises, but when your mind is not settled, your mind is not calm, you are not going to have any wonderful health. Because right now there is a lot of research published on heart disease and stress, heart disease and cancer, heart disease and blood pressure, heart disease and diabetes.
Right.
Being a physician for the last 45 years and almost 51 years in the medical industry, from student to this, I see a clear link when people are under stress, how their diabetes goes south, how their blood pressure goes south, how even the cancer starting to grow crazily. Just to give you a very interesting example, on Monday, I saw a patient, which I saw 5 years ago, with a stage 4 glioma. And gliomas are death sentences, as you know. So we treated her for almost 1 year, and she went into a remission. And her doctors, the regular oncologists, were calling her a kind of miracle child. Like, this is a miracle that and she is around 74 years old. And when I saw her after 5 years, I started crying. I said, God, look at her. And she said, I'm some wonderfully good. Thank you for all the efforts which you have put in together. And I'm still alive and able to do almost everything. Yes, I have some weakness, but otherwise I'm right here. So one of the thing which I gave to her, this is, you will not believe, there is a Sanskrit mantra which you is called Mahat Mrityunjay mantra. So it is recited, and there is a research published on it. What they did, they took a stroke patient, 40 stroke patient, 20 stroke patient got the regular medical treatment, 20 got the mantra recited remotely onto them. It's like almost Dr. What his name is? He is very famous. He does the Christian faith healing.
Mm,
I forgot forgetting the name of that
I don't
doctor
know.
right now. And he has done published a lot of data on surgical procedure, heart procedures, and when people has the praying done on them, even remotely, their outcome was much better. So this 40 patient, when they had this recital of this mantra, their they out of 20, 18 woke up the deep coma,
Yeah.
and there 20 out of 20, none of them woke up with the regular care. So
Mm,
the power of mind, power of chanting, doesn't matter which religion you chant, like there is lots of examples available around the world. So there is a some positiveness in the mind when you are chanting or you're doing something positive. You are sending vibes to the body that it is going to be all normal, it's going to be all healthy, and you start listening, your body start listening, your cells start listening, and you transform and get better.
incredible. What are your thoughts on acupuncture, Dr. Sodhi? Do you use that very often, acupuncture in your practice? Any experience, thoughts on that?
See, I'm not trained in acupuncture because in Arizona the law is different.
Oh,
You
yeah,
guys
right,
can do
right.
acupuncture,
Unless
but
you
in
have your LIC.
Washington we don't need to do acupuncture. But I love acupuncture. It's same kind of energy. I send a lot of patients for acupuncture,
Oh, you do?
for low back and people with even pregnancy issues and people who has uh, kind of anesthesias, sorry, paresthesias, all those kind of stuff. I send them, and even for just well-being, I personally get acupuncture myself too because I have the L5S1 kind of bulge, and it actually
Uh-huh.
creates a sciatic pain in me, and I got some really good benefit. But now I had got a PRP, and which has made me, amazingly better with that treatment. So I think again, yes, acupuncture is also based on energetics and has amazing healing properties.
Good. Thank you for bringing that up and breaking down the holistic approach to this. And what would you what would you say for if someone's asking for specific botanicals or formulas that you can find effective for supporting mental well-being from Ayurvedic naturopathic perspective? Tell us a little bit about that, or any products from Ayush or Ayurveda that I can pull up here on the screen share. People are always looking for ways to support their lifestyle with
Yes.
herbs or supplements.
So one of the best herb, very non-toxic, is ashwagandha.
Hmm.
And it's shown to lower your cortisol. So what happens when you're feeling anxious or even when you're frustrated, angry, your cortisol levels go up.
Yeah.
And when your cortisols go up, and cortisols are very important for us to keep us survival, but they are very high octane fuel. They should be utilized for very short term and then go back to normal. But when they go on kicking too much, they cause a lot of health issues. So cortisol levels dropped around 30% when you take ashwagandha. And again, I want to emphasize here because I see a lot of patients coming from India and Asian other places. They bring ashwagandha with them. Oh, I'm taking ashwagandha. Boy, all the ashwagandha are done the same. And
Yeah,
usually, what
yeah.
I'll tell them, bring your ashwagandha and I will show you the difference. So we open up the capsule in front of them, say, taste it, look at the color, and when this, oh my god, what a difference. So standard is very important. And our university in Portland, the NUNM, has done studies on various ashwagandha, and they found that ashwagandha for Ayush was one of the best one, and is not given any official, but is given oral, said, this is the best ashwagandha we got. So we have really good product ashwagandha. The another one is AyuDep, which is based on saffron. Saffron, I think we talked about previously too. Saffron has an amazing effect on depression, anxiety. There has been studies done, and it has been head to head compared with the serotonin reuptake inhibitor, SSRIs, like your Prozac and Celexa, those kind of drugs.
Yeah.
And it shows parallel, comparable results. And what I like about it, it has zero side effect. And saffron, I think we may have talked about in the past one too. Saffron was given to the monks, and they used to wear the robes which
Yeah.
was soaked in saffron, which calmed them down. That's why, even now I think nobody can afford to have the saffron robe because it's so expensive, but they still have the robe color is saffron.
Uh-huh.
So that is, has
Interesting.
that kind of like a look to it and makes you feel calmer. So the AyuDep has saffron in it, is amazing, good product for that. Bacopa Plus is another. These are all nervine herbs. They help on the nervous system. It has
Uh-huh.
the Bacopa moniaris, Centella asiatica, Ashwagandha. These herbs help you calm down. Another, my favorite, is also Shilajeet.
Uh-huh.
Shilajit is a minerals, and as you know, when we have anxiety, stress, depression going on, we are actually going through more of the mineral depletion in our body. And these are bioavailable minerals. So when you take it, it actually stabilizes you. You feel good.
Uh-huh.
Like even naturopathic remedies give different minerals for people who has anxiety and depression, or give good quality multivitamin which has all the minerals in it, and it makes a big difference. There is also lots of studies published on these things
Yeah.
available for helping and balancing it. So another product which we have is the AyushMulti. So this AyushMulti, again, is going to sound like that I'm trying to praise my product,
No, I
but
know.
it is one of the best multi. And if you compare apple to apple, a lot of times, people go and buy from Costco big bottles, huge 180 capsules. It's a 90 capsule.
Right.
They think it's small. So then I said, okay, tilt the label on it and see how many capsules has this formula. So they will say 180 capsules. Six capsules contain this formula.
Yeah.
And this Ayush has one capsule has the formula. Again, they were not going to use the expensive stuff in it. They are going to use very less, like for example, biotin is very expensive, as you know. It's
Right.
2,000 microgram in it. So very, very powerful, very balancing. Then they are not going to use the B6, the better kind, like pyridoxal 5 phosphate. They're going to use pyridoxal hydrochloride, which is not very bioavailable. They're not
Yeah.
going to use the methylcobalamin, which is more bioavailable. They're going to use a cyanocobalamin. They're not going to use the 5 tetrahydrofolate. They're going to use folic acid, which is like a pee, you pee it out. So it's not bioavailable. So even if you take a one capsule of it, it is going to make such a difference rather than taking those 6 or 8 capsules of those. So that is the difference when you go and when you buy a product which is standard and which is made by the doctors who know what they're doing. This is what they have studied all their life. Like, all naturopathic physicians study them very deeply. Unfortunately, our colleagues out there in the medical field does not have a ABC knowledge about it.
Right.
Them,
Yeah.
those are all the same. And they actually, I don't want to bad name any product, but all those very famous product on the TV does not compare to our product. And not only me, but my all naturopathic colleagues who has formulated product, they have done the best job in the industry. So if you don't want to buy Ayush, look for who is making it. If it's a naturopathic physician, he has done the best job for you guys.
Absolutely. Appreciate you sticking true to our profession, my friend. And you've done a lot of work here in the naturopathic world and the Ayurvedic world. It goes without saying. So thank you for giving us kind of an overview there, Dr. Sodhi, of some options available for someone that's stressed out, dealing with mental health difficulties, even depression potentially. And which product you pick, folks, it depends on what exactly is going on. That's why it's good to work with a naturopathic doctor like us or whoever's in your local area, like the AyuDep, for example, which has the saffron, maybe is going to help somebody more with the depression side, potentially, since saffron is a super good antidepressant, one of the original antidepressants versus ashwagandha. Maybe if you're just stressed out, have lower testosterone levels, it can help with that as well, but so can
Exactly.
Shilajeet. So it really depends. How would you have somebody start, Dr. Sodhi? Where would somebody start? Maybe the multi even.
Yeah, multi and ashwagandha, you can go wrong. So
Uh-huh.
just start with one multi a day and see how you feel. And then ashwagandha, you can take one capsule twice a day. If not, I even rev up to in my case, like when I undergo a lot of stress, which I'm lately these days are, I'm taking 4 capsules. I just took 4 capsules this morning of ashwagandha
Wow. Uh-huh.
because I'm building a house and I'm having a nightmare with the city inspectors and their
Yeah.
requirement said, I was supposed to move last month. I'm still not moved in, and I'm
Oh.
have no place to live right now. I'm staying in a hotel. So ashwagandha is
Uh-huh.
keeping me sane. I'm taking 4 capsules 3 times a day, and I've done it many times whenever undergone a lot of very stress. I have done that, and the AyuDep I take at night because it also promotes natural sleep. Saffron has a natural sleep promoting, and when you sleep well, from 10 to 6 or 5 a.m., your battery charges. And this is the best way of charging your battery. Unfortunately, even if you take a sleeping pill, that does not charge your batteries. That
Oh.
is, the studies are available. People who take sleeping pill, they die prematurely.
Yeah.
And even small amount of
Wow.
sleeping pill doesn't help overall survivability. People die prematurely. So that's why I like these, which has been tested, been used for centuries and centuries, and has an amazing positive effect.
And why include the MSM and boron into the formula, Dr. Sodhi?
Very, very nice. Yeah, the MSM, basically, we need sulfur. Sulfur is a wonderful detoxifier in our system.
Oh.
It detoxifies the thing. So small amount of it, because we have so much oxidation, so much xenobiotics, so many xeno hormones in our system,
Yeah.
and they need a methylation. Sulfur does the best job for the methylating all those toxic stuff. If we look at our food chain is so toxic. I was just thinking this morning, like buy any packaged food, it comes with preservatives. And no wonder our microbiome got the biggest hit because what we're eating is not a real food. We're eating preserved food, and that is going to kill. If it can kill the bacteria on the shelf, it will also kill your own bacteria too. Maybe not
Mm.
in a huge amount, but small amount. But over time, it is going to have a bigger impact on you. So the gut health is so important for the mind health. So that's why I encourage people to eat lots of vegetables, eat good nuts and seeds, eat good oils, ghee. The grass-fed ghee, especially from A2 milk,
Yeah.
has all the essential amino acid which we need, and it goes to the brain because this is a crosses the blood-brain barrier. So that's why ghee has been given such a wonderful accolades in Ayurvedic medicine because you can. Brain is all fat, by the way, and when you get the good fat to your brain feel calmer and satisfied. So even there is a lot of studies available on Amazon, sorry, not Amazon, on the Alzheimer disease,
Yeah. Yeah.
and they're showing like saturated fat, which has been given very bad rap, has shown to reverse the Alzheimer kind of disease because brain is what is all fat, and
Unbelievable.
fat can exchange with the fat. So what it does, it pulls out the toxic load from your system and detoxify you. It's because it's like a lecithin. Lecithin is a plant fat, by the way, but
Right.
you have the fat has this natural compounds in it which binds onto this toxic load, clean up the membranes because all the cell membrane is a fat, is cholesterol. And when
Right.
you give those good things, it sucks it out, clean it out, throw your digestive system down the drain, and you are feeling fresher and healthier.
That's incredible. I need an hour with you, Dr. Sodi. We got to break this down here. So, I didn't know, by the way, that ghee has all the essential amino
Yes,
acids
it
in
is the
there.
all
Uh,
bioavailable essential amino acid,
that's
grass fed, of
interesting.
course, not the other ones. Yes.
Okay, very, very interesting. And then, of course, I thank you for sharing your specific dosage on the ashwagandha with Anya somnifera. Sorry that you're going through that stress. That's unbelievable. 1 month now you're waiting, and you still found the time to come on today to educate us here on the podcast. That's a true, that's discipline right there. Someone that's a man of the people. And that's giving you 6 grams a day according to your dosage of 4 capsules
Exactly.
TID,
Exactly.
which is 2 grams per dosage there or per time he's taking it.
Dr. Dija, let me tell you, like
Yeah.
I will be all my sirens will be going bang, 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 and I will pop in 4 ashwagandha,
Uh huh.
45 minutes. I will be like a tranquil, like nothing has happened. It is that
I believe
amazing.
it. I
It
really
is that
believe it.
amazing.
Yeah. It's one of the
And
most well-studied botanicals in the world.
exactly. Very, very wonderful. Non-toxic on top of it. We did a the animal study, which we should not, but because, people want, oh, but is that a toxicity level?
Yeah.
The 25% of the body weight of the animals could not kill them.
Huh.
You cannot say that even with the water, by the way.
Right.
You know,
Right.
yeah.
Yeah, yeah.
So the like if you take that much, you like I'm 160 pound. So if I take 40 pounds of ashwagandha, it will still not kill me.
Yeah.
I cannot say for water that way, because if I take
Exactly.
that much water, it will kill me. Water kills you
Yeah.
with a
So
hematology.
this is a perfect example of taking something that it's like putting on a shield to help
Exactly.
with the stress around us. We can't always change the stress that
Yeah.
happens to us
Yeah,
in this
and a lot of
world.
my naturopathic colleagues has a wrong thought process that ashwagandha will make your prostate cancer worse. It
Mm.
is the opposite. It actually, I give to my prostate cancer all the time. And I have stories after stories to tell you. The PSA stopped dropping. People start feeling good. And, so it is. And I think Dr. Gio, who's another naturopathic physician who focuses on neurology, I just saw his podcast recently, and he was saying, no, ashwagandha has shown no studies that it worsens the prostate cancer. But my lot of naturopathic colleagues, especially in oncology, somehow are misinformed because they think anything which increases testosterone will worsen the
Yeah.
prostate, and it is not true.
I'm shocked you're bringing this up right now. Literally, all the last 2 3 weeks I've been talking about this with men, that they make such a simple black and white statement. More
Exactly.
testosterone, worse cancer. Even though
No,
we
but
have research, Dr. Sodhi, that people with low testosterone can
yeah,
have more aggressive forms of prostate cancer. Right?
exactly. And there, even the Harvard urologist, I forgot his name again, he gives testosterone to people who have the prostate cancer after they have been castrated.
Interesting. Yeah.
Yeah,
Yeah, so there's a lot of misconceptions out there, right? Myths and misconceptions. That's why we need to do this
exactly.
show. That's why this
Yes,
show is
exactly.
important to help people.
Yeah.
And I'm really grateful you highlighted the ashwagandha, the AyuDep, the Shilajeet even, and then the general multivitamin. Some people have
Yeah.
mental health difficulties, stress, anxiety because they're not getting enough nutrition in
And
general.
I forgot to tell probiotics, good probiotic 100B, good because gut flora, as everything. If you are absorbing your food properly, your gut bacteria are happy, you're happy.
Absolutely. Yeah, we know a lot of the serotonin is produced in the gut, 95%,
90%. Yeah.
right?
Exactly. Yep.
And then that travels up into the blood through the blood brain barrier and helps control our mental health instability there with our nerves. So
Yeah, we
yeah,
talk about vagus nerve. Where is the vagus nerve starts? In your gut.
in the gut.
And when there are now devices, you put electrical devices to calm it down. But you're doing simple breathing exercises with your belly in, so belly out when you breathe in, and when you breathe out, your belly in. So that triggers your parasympathetic system. So you're making your own vagus nerve calming effect. If you just reset yourself a couple times a day, 10, 15 minutes, you'll be amazed at how much better you feel.
Thank you, Dr. Sodi. And then we'll finish off with one of the most important, maybe the best for last year. Tell us about a digital detox. Why is this so important? People are laying in bed complaining about their sleep, but the light is slamming them in the face like this on their phone. Tell us
I,
what your thoughts of a digital detox. Is this
You
important?
know, the funny thing is, they said that in South Korea is the highest consumption of digital media in the world. And
Oh, wow.
they have even 2 years old kid getting addicted to, because they have those iPad which has games on it, and the baby touch it and then get addicted to it. And now the government is spending money to detoxify. They have rules now that you cannot have those kind of things for the younger kid.
Wow.
So it's very important, because what it does basically, it has a light blue light in it which shuts off your serotonin production. And one interesting thing, we think that we produce this, sorry, serotonin and melatonin, mainly melatonin. Even we produce melatonin in the daytime too. And that comes up with the far infrared light. which is present in outside. So going outside is so important because now this small amount of melatonin which we produce in the daytime helps to clean out your mitochondria. So the research is amazing, and it coming back to the real living in the mother nature, not in the box houses, which is not making us very healthy. So going out, going in the morning walk, evening walk, the moonlight again, we reset our cycles, we reset our circadian rhythm.
Right.
And these television, I shut off them everything around 8 o'clock at night. So I have a 2 hours of completely, I listen to music, I love music. You can listen to some, talks, other thing, but don't watch television. Don't watch at your computer, but look at our whole society. We have this, as soon as we wake up, the first thing which we do is open up WhatsApps or something else to get in, which is not going to be helpful for us. You're going to see a lot more issues coming in the near future.
Absolutely. Couldn't agree more. We've never had so many electronics like in the last even 40 years since the
No.
internet and smartphones
Yep.
and the television. So absolutely important to try to wind down on that. It's like light pollution, electrical pollution, right? That we're exposed to
Yes.
all day. Dr. Sodhi, that wraps up the time that we have for today. I always appreciate you, my friend. Thank you for all
Thank
the
you very
work you
much.
do and sharing your insights and helping people all these years in our field. You've been a big part of the naturopathic world. Thank you for your time.
You're welcome. Take care. Bye bye.